The next set of hormones that we'll be talking about come from the posterior pituitary gland. And the first one we'll discuss is oxytocin. As mentioned in a previous video, oxytocin is the hormone that is released for contractions during childbirth and also causes milk letdown in nursing mothers. Oxytocin is known as the cuddle hormone, but that is rather simplistic way to put it because it is more complex and it plays an important role in social interactions and bonding. So you have that as well as one of the functions of oxytocin. There is a synthetic version of it that they sometimes use to induce labor. It's called pitocin. Its use is kind of controversial. And it's used to induce labor or to augment labor, speed it up, basically. So one of the things that we'll probably be talking about in our discussion are the pros and cons of inducing labor. You also have the antidiuretic hormone, or ADH. ADH is also called vasopressin, and it is stored in the back of the pituitary gland, so still posterior pituitary, and it regulates water balance. So, if you think about it, too much urination can lead to dehydration. So if you pee too much, you get dehydrated. And when the body is dehydrated, what happens is it's going to send the ADH hormone, and will send signals to the kidneys to conserve water, to help fight the dehydration. So basically it is, or how it works is there is a set level of water in the blood where your body is happy. And what happens, if it drops below the normal range, your hypothalamus detects that higher concentration of solutes in the blood. And so it is going to create feelings of thirst, and it's also going to stimulate the posterior pituitary to release ADH, and that is going to go to the kidney, and so the kidneys reabsorb more water to help fight dehydration. Now, if the water level rises above its happy little set rate, and the hypothalamus will detect the lower solute concentration, and the pituitary will release less ADH. So the kidneys will not absorb as much water until it goes back to its happy homeostatic set rate, or concentration in this case. So that is yet another negative feedback loop that the endocrine system uses. Because if you remember back to the other video, set rate, if it goes above or below, it's going to change the hormone, or how much of the hormone is released, and affect the body system. Now, so we talked about antidiuretics. There are also diuretics, and those are to increase your urine production. So many common foods and drinks contain chemicals that are diuretics. Alcohol would be one of them. Another medication that is a diuretic that we might be familiar with is Midol, and it relieves the symptoms of bloating because it makes you urinate more, so you're actually not retaining that water. And that's what we have for the pituitary gland. So now we're going to look at the hormones of the thyroid gland. And thyroid hormones are responsible for controlling your metabolism. So that's the body's ability to break down food, store it and use it store it as energy, and then release it as energy. So all of those metabolic reactions that you heard about in biology, the Krebs cycle, the electron transport chain, cellular respiration, are parts of your metabolism. Thyroid hormones, the first one we're going to talk about is thyroxine and triiodothyronine, so it's T4 and T3. Both increase the rate at which cells release energy from carbohydrates, and they also have calcitonin in your thyroid that regulates the concentration of calcium in the blood. And one of the assignments is actually going to be calculating your basal metabolic rate, or how many calories your body must consume to maintain life. Problems with the thyroid. So if something goes wrong with your thyroid, let's say in this case, iodine is essential for the formation of some of those hormones, thyroxine, and a lack of this iodine to make the hormone is going to cause swelling of the thyroid. So basically you get giant bulbs on your neck, and it's called goiter. Iodine is found in seafood, but also you see it more commonly on grocery store shelves as iodized salt. So without that, a lot of people, without getting iodine from salt like that, a lot of people would have those goiter, giant neck bulbs. All right, you also have hyperthyroidism, which is another condition. You have hyperthyroidism in infants. You have Graves' disease, which is an overproduction of a thyroid hormone, which causes an enlargement of the thyroid and other symptoms. Heat intolerance and anxiety would be some of those symptoms. Other things that could affect the thyroid is exposure to radioactive iodine. In childhood, it can cause thyroid cancer. After the nuclear power plant explosion meltdown of Chernobyl, there's actually an increase in thyroid cancer in children because they were being exposed to those radioactive materials. Then there's the parathyroid glands, and those are located behind the thyroid, and they're 4 tiny glands. And they parathyroid hormone, they produce that PTH, which takes calcium from the bones to make it available in the blood. And those are the parts of your thyroid gland. And we'll stop there, and we'll be talking about your adrenal glands in the next video.